Hello and welcome to the Herbal Clinic MD. I'm Dr. Mark Hashim. Today I'd just like to talk to you about how to get off of your pharmaceutical medications when you treat yourself with cannabis. And that's one of my favorite things. I have seen thousands of patients come into my office who are stuck on different medications that are negatively impacting their lives. Opioids, benzodiazepines, neuroleptics, antidepressants, and the list goes on. What I've noticed over my 3 years of doing this is that patients have been able to get off of those medications and actually become big pharma free. And how is that done? Well, really what I do is I encourage you to start your cannabis, but do not stop your big pharma medications. Keep everything the same. And after you start to feel better, then you start to wean back and cut back on your medicines. The first medication that you probably will be able to get off rather easily is going to be your opioids or your narcotics. And the reason is the narcotics and the THC bind to the same receptor. So you can quickly start to cut back on your narcotic as you're taking your cannabis. Then the next thing I see people get off of rather easily are your benzodiazepines. Now this is going to take a little bit of time. What you do is you start getting yourself feeling better, less anxious with the cannabis or the CBD, and then you gradually cut back on your medication. Maybe cut it in half for about 2 weeks and then cut it in half again. And before you know it, you're no longer taking those benzodiazepines. We have to realize opioids and benzodiazepines currently are killing 186 people every single day in the United States. So it is imperative that we figure out ways to solve the opioid crisis, the benzodiazepine crisis, and cannabis is certainly a way that we can do that. I've also noticed that my patients have been able to get off of their antihypertensives. The reason is cannabis binds to your hypothalamic pituitary adrenal axis. It lowers your cortisol levels. That lowers the pressure on the heart, and as a result, you're able to get off of the antihypertensives. People are also able to get off of their neuroleptics. That's the gabapentins or the Lyricas. And as they start to feel better, they no longer need those. I will warn patients, however, I've noticed it takes quite a while to get off of the gabapentin and the Lyrica. Some patients even report that it's harder than the narcotics or the benzodiazepines. So take your time, slowly cut back on the doses, decrease the frequency, and before you know it, you're going to be off your medications. Let's face it, I'm here to help you get off of your drugs, get off of big pharma. We know that you're not designed for those medications. You know that you don't want to take those medications, and together I can help you get off of those. Thanks and have a great day.